Welcome to today's podcast. Today, we have a very special guest with us, Dr. Sarah Johnston, who is a chiropractic physician, a wellness consultant, co founder of Forest Air for Everywhere, as well as a certified HeartMath practitioner for stress management. Based in Portland, Oregon, she has spent over a decade helping patients with trauma recovery, chronic pain, pediatric care, and more. Her global journey has taken her to Indonesia, Mexico, and Europe, where she has explored diverse healing practices. Dr. Sarah believes mental and physical health are deeply connected and focuses on empowering individuals with self-care routine and non-invasive techniques to overcome stress and illness. She's passionate about restoring balance and vitality while guiding other holistic practitioners to create safe, healing environments.
Hi, Gina. Thank you so much for the warm and welcoming introduction. Like you said, how I got into all of this was really my background in chiropractic. And when I was in school, I had gotten through a lot of really severe health challenges. And that's what really sparked my interest and passion into studying other holistic practices. And when I was working in the clinic environment, like you mentioned, I was seeing conditions from sports injuries to car accidents and pediatric care. And really, over time in the clinic, I was finding that I just didn't feel I had the full resources to really help people. And that's what really launched me into traveling and learning about other modalities such as light and sound and frequency medicine. And it was really my time abroad and being in different cultures, like you mentioned, that I could really experience how much our environment deeply affected our health. And so in 2023, I had gone back to the US and gotten back into the clinic world a little bit and was working with a lot of different doctors in cellular health and wellness. And we all know the importance of water and movement and nutrition and sleep and even connection for our health. But in all of these things, no one had ever really brought up the importance of air quality in our health. So I'm going to go ahead and share now a presentation that I made.
Sure.
A little
Thank
bit.
you.
Perfect. Okay, so like I just mentioned, the pillars of human health, we talk about water, nutrition, light, and sleep, but nobody in the industry is really talking about air quality. So that's what we are talking about today. That same year in 2023, I was introduced to a German technology that makes activated oxygen. And at this time, I had no idea what this was. I never learned about this in school, nor how I encountered other people in the industry really supplementing with such a thing. We've seen technologies that provide high volumes, high amounts of oxygen, but this was something that I never heard of. So we're going to be chatting about this today. So, going into the importance of air in our health, air fuels cellular energy. So, every single breath we take influences the health of our entire body. In cellular respiration, our cells use oxygen to make energy, which actually supports the way we absorb water, digest our food, move, our mood, and our brain health, and even the quality of sleep and our circadian rhythm. So, air is actually our largest daily intake. On average, we breathe in 8 to 10 liters of air per minute, and this adds up between 10,000 to 15,000 liters of air every single day. So, we all know that we can go weeks without food, days without water, but we can only go minutes without air. And the shocking thing is when we ask people, what do we think air is made of? And most people tell us that air is only oxygen, when in reality, air is actually a dynamic blend of nitrogen, noble gases, water vapor, and CO2. And in that combination of the whole entire atmosphere, oxygen is only 21%. So, most conventional oxygen therapies only focus on quantity. So, if the bigger picture is in that entire blend, only 21% is oxygen, and we can only absorb 5% of that, it makes us wonder why we're actually giving people more oxygen. So, there's a famous German scientist named Victor Schauberger, which talks about in order to understand nature, before we copy nature, we must understand it. So, what actually happens in nature? Most oxygen in the air exists as triplet oxygen, which is a stable ground state. And during photosynthesis, when plants absorb more light than needed, some of those photons are actually transferred to oxygen molecules. And when this happens, this creates singlet oxygen, which is a higher energy form of oxygen. And this process only lasts a few nanoseconds before singlet oxygen actually releases those photons and returns back to triplet oxygen. And this might sound a little bit confusing, and it's something that I never learned about in school, but it's something that is just absolutely incredible and relatable for our health in today's modern world. So, the problem in the modern world is hundreds of years ago, we had access to cleaner air, natural light, and balanced ecosystems that really supported our health and vitality. And today, we're surrounded by pollution, artificial light, and climate controlled spaces that really disrupt this energetic process from happening. And according to the World Health Organization, 99% of people in the world are affected by pollution today, which is very significant. And what this does to our body is stress, whether it's environmental stress from pollution and even emotional stress, disrupts our body's innate ability to use oxygen, which leads to increased free radicals, further oxidative stress, and faster cell aging. So, the more chronic stress we have, the less we're able to utilize oxygen, and this can be linked to many chronic conditions. So, the solution isn't raising the volume of oxygen, but about helping our body utilize oxygen better. So this is where we come to our solution, which is our company, Forest Air for Everywhere, and we actually make light activated oxygen. So a little bit about how our technology works is we use specific wavelengths of light to interact with a catalyst in our device to actually create these photons. And I'll show you later with the devices that we have, but we actually breathe in these photons through a nasal cannula. So, a little bit about our devices. So, Forest Air is a registered wellness device. You don't need a prescription, it's easy to operate, it's safe for all ages. You can use it while sitting, lying down, prone or supine. You don't have any risk of oxygen toxicity or overexposure, and it's affordable for daily use. So this is our home device. We like to use it for home and for travel because it's so portable, and it's powered by two catalysts. That's like the little chlorophylla that you would have in nature, but in our device, we use something else, and I can't share because of a patent, but it's pretty amazing. And this little guy you use for 1 hour a day, and depending on your symptoms, we recommend between 1 to 3 hours. and it supports one user. It's really easy to operate, which I'll show this later. And you breathe in through a cannula or a headset. This is our professional device. It's able to be used with two users at a time and has six catalysts. And if you were the only one breathing, you're able to be using six catalysts at a time, which is a significant amount of power. And we absolutely love this for our patients that have really, really chronic symptoms because it just gives them the extra energy and support that they really need. And so, some of the top health benefits, whether you're using the Pro or the home device, are increasing oxygen utilization. So, it supports the way that our red blood cells are able to release oxygen to the tissues, therefore, supporting cellular energy production. And when we have more energy in our cells, we're able to recover faster, which is incredible. And it reduces inflammation and speeds up recovery from physical stress, injury, and chronic illnesses such as COPD, cardiovascular issues, and even chronic fatigue. And the third is nervous system balance and stress resilience. And we see this in the way that it can improve heart rate variability, which is the body's ability to actually adapt to stress and be able to put your body into a rest and digest state. And so when your body is able to rest better, it naturally improves sleep quality and you're able to get deeper amounts of sleep, which improves your circadian rhythm. And then when you're able to sleep better, you're able to have better cognitive function. So it's just a total, complete, amazing cycle, right? And our brain consumes the largest portion of the body's oxygen supply. So this is going to help with increased focus and increased productivity and mood throughout the day, which is something that we all really need support with today. And then lastly, reduced lactic acid and improved performance. So, this is incredible for everyone who's physically active or if you're an athlete. When we can improve oxygen utilization, this actually shifts towards having a aerobic metabolism and you're not reliant on anaerobic pathways. And so, this is the process that actually helps reduce the lactic acid, which is pretty cool. So, some detox reactions that could happen because when we're starting to clear out toxins or any kind of excess mucus in the body, of course, it's perfectly normal to have some detox reactions. We actually welcome this. So, some listed here are some lightheadedness, you might be coughing up some mucus, some mild headaches, skin changes, digestive changes, or temporary worsening of symptoms, but this is all perfectly normal. And yeah, we do encourage this, right? So, some research studies since 1995. This technology has actually been out since the 80s, and there are only a handful of people in the world that have the patent. And we were fortunate enough to collaborate with our manufacturer on this. And he's gathered studies since the 90s, and we're continuing to do studies, but the most significant have been with patients with COPD, macular degeneration, even children that were exposed to radiation from war in Ukraine. These children had issues with their heart, with their nervous system, and with their lungs. And after 11 sessions, breathing light activated oxygen, they all improved significantly, which is incredible. We've had studies with chronic fatigue, with sportsmen, even with autism, children being able to get deeper amounts of sleep, which then improved their cognitive function in the day, and yeah, much more. Current research that we're working on now, we have a few studies in the UK. some with cerebral spinal fluid to the brain. And just because of the validity and the time it takes to really get these studies done, that's just going to take a couple more months for us to get that out. We also have some groups with long COVID in the US that we're starting with, which is really, really promising and amazing. Our practitioners in Germany actually are now starting to do a lot of studies with HRV, and then more COPD and ATP studies are coming. And for those wondering if you're a professional, where can this be used? What kind of environments? And even what kind of professionals? That is just absolutely endless. So if you're a alternative medicine doctor and you're supporting patients with chronic illness, or if you're exposed or live in an environment with poor air quality, if you also run just a palliative care or are involved in a wellness center, it's amazing. It's incredible for jet lag. So if you have a retreat or a hotel and people are traveling to you abroad, it's amazing for recovery. Um, Even in corporate wellness, if you have a lot of employees that are stuck inside all day and you want them to be able to have more productivity or even increase their immune system, it's incredible. And then the same thing with sports centers and gyms. It's incredible for supporting athletes, like we mentioned. And then additional benefits and uses. There are a few. So, energizing our water. Right now, Dr. Gerald Pollack, he's quite famous in the water world for exposing and educating us on what we did not know about water, which is that water can have a structured, more energized state, which we refer to as fourth phase water. And this can actually be activated by light. And this structured water is essential for cellular energy and detox and cell communication. And because our device is releasing excess photons, you can actually cut off the end of a cannula and place that in water, and it bubbles and energizes it. And you can drink it for additional health benefits, which we love. The second is aromatherapy. You can place a couple of drops of aroma into the end of a cannula, and this can just add a really nice sensory experience for people in any kind of wellness environment. And of course, using high grade oils because we're putting that into our body, but it can provide extra support for respiratory health, stress relief, and immune balance. And it's just, yeah, delightful to be able to breathe in other smells. And so just a little summary now on how our device compares to other oxygen therapies. So in today's clinic world, the most popular forms of oxygen therapy are ozone, normobaric, and hyperbaric. And our device uses these catalysts to activate the oxygen without increasing the volume of oxygen. And so there's no contraindications, and we love that it can be used anywhere. So by a doctor or by somebody at home. And although uh, ozone and hyperbaric, they are absolutely incredible, especially in life-threatening situations. It can just have more contraindications and more restrictions and less accessibility, right? So we know that there are a time and place to be using these technologies, but on our end, we're really passionate about giving a natural therapy without having to worry about the risks and harms that perhaps oxygen toxicity could really create. And so, this is for some of the doctors and practitioners out there. that could actually be interested in measuring these effects in their office or in their clinical environment. And that is, we actually really recommend doing HRV testing because no matter what client you're working with, whether they're suffering from cancer, chronic autoimmune disease, or they've had some kind of toxic exposure, all healing happens in a regulated nervous system. And in today's world, we're all exposed to more toxins, more stress, and this only adds more burden on our nervous system. And so HRV actually really supports in real time a shift in nervous system balance. And we like using polar, but that's just because of the accessibility and easiness to use it. But we recognize that there are amazing um, HRV technologies out there, and other ones can be used too. And so, for those that don't actually really know what HRV is, it's the variation in between heartbeats, and this reflects how our body is actually able to adapt to stress. And so, it's that shift in being able to take action or to take rest. And so, when we have a higher HRV, this means that we're able to better adapt, we have greater resilience, better cognitive function, our body can detox better, and we even have more energy to regulate our emotions. Whereas with a low HRV, this can lead to chronic stress, inflammation, poor recovery, and even have a greater risk for disease. So, one of the easiest ways that we can actually improve HRV is with the quality of the air that we breathe. And so, yeah, just some final words. We recognize that our technology is not the cure for air pollution, but it's an incredible tool to gain resilience and integrate it into a healthy lifestyle. And we have a ton of research on this, and there's just so much to cover that we couldn't cover in this presentation. So, if anybody is interested in learning more, we'd be so happy to share.
That was such an informative presentation, and there was a lot of information to take in, and it's very true. Very little emphasis is given to air and academics, and it is so important to share this with students at a young age and let them understand what air is all about. Thank you
Yeah,
for
thank you,
giving that.
Gina.
Yes. So we have a couple of questions from our audience, and I would like to throw it out to you.
Sure.
Um, yes. So the first question is, what impact has forest air's oxygen enhancement had on recovery, performance, and approach to training?
Yes, so like we talked about with the health benefits of helping to regulate the nervous system and improving HRV, and then even being able to help reduce lactic acid production after exercise, there are a few examples that I can think of. And first are with myself working with clients, and then even friends and colleagues and our partners that do body work with people. When we do body work, and that meaning manual therapy of massage, craniosacral, myofascial release, uh, being able to help people actually get into a parasympathetic state is really crucial. And most people go into therapies and they're stressed out, they don't know how to relax. And body work is an incredible way to do this. But when paired with forest air, this is where we've seen people's ability to actually relax, let go, and even their tissues are able to be more mobile, and this can be reflected in doing HRV testing, which we've been doing with people. And the patients and clients that get off the table also report how much they were able to relax, and they feel that they can breathe deeper in their lungs, and they also have more energy just throughout their entire body. And so that's just one example. And so for lactic acid production, we've had a lot of athletes over the years using it. But right now, we actually have some professional German athletes who are in MMA and boxing, and we're getting really good feedback about their ability to recover after fights. So that's more so subjective feedback, but we also have trainers that are starting to do some lactic acid tests and HRV with them too.
That's really amazing. I mean,
Yeah.
in addition of forest air in sports recovery will definitely be a boost to
Yes.
performance. Yeah.
Yes, of course. And I mean, it's it's even ironic too because most professional athletes are training even in small spaces, where there
Yes,
actually isn't even a lot of fresh air. And so the more that they're even exerting themselves, the more that this is actually benefiting their performance and recovery too.
absolutely. Okay. The next question we have is how has using the device impacted COPD patients in terms of breathing, energy, and overall quality of life?
Yes, so a lot of COPD patients that we've worked with are actually some of the fastest clients and patients we see to feel improvement very quickly. So there's been numerous people that have been breathing it for 1, 2, 3 days, and they already see improvement with being able to walk upstairs better, sleep better, their ability, yeah, just to be able to get around, because most people with COPD can't really exert themselves because they're not able to take deep, full breaths, which significantly impacts their daily life. And so, a few people that come to mind that have had COPD have actually been here in Germany, and they've been able to, yeah, get around better, walk better, get upstairs, be able to perform daily chores better around the house. And they've been monitored and treated by their primary care physicians and have gone in and had lung scans and lung function tests and are actually seeing improvement now with their lungs after using forest air for 2 weeks, 1 month, 2 months. Yeah, which is really incredible.
Wow. Yeah, that's truly incredible to see the benefits in such a short time period.
Yes. Yeah, it's
All right.
great.
Okay. The next question is for the elderly with limited mobility, how
Mhm.
has using the device improved energy levels and overall well-being?
Yes, so kind of going back to what I just said, even with COPD, most of our geriatric clients and patients have been those suffering from COPD or even long COVID, and just having the energy to do their daily tasks, like cleaning and grocery shopping and being able to move around. It's really helping them, give them more energy to do these tasks.
Oh, nice. That's really nice. You know what I'm really waiting for is for you to do a demo. So why don't we, you show us how to use Forest Air. And like you're saying, it's so easy. So I would love to see it and get on to using it as well.
Yes, yes, of course. So we can start with the home device, which I
Okay.
have right here. And as you can see, it is very small, very durable, made of aluminum, and it comes with a power supply, which you can easily just plug in right here, and a cannula, which I'll put on my face in a moment, but really easy. You plug it in here, and then you click on, and you know it's working because you see the light coming out the back.
That's
And
really simple and easy to use.
extremely simple.
Yes.
And so for those people that don't like cannulas,
Mhm.
there are available headsets,
Okay.
but really easy. Put it around your nose like this, excuse the hair, and yeah, pretty easy. And
Wow. Yeah.
for those wondering why you have to breathe it through a cannula, it's because of the significant amount of airflow that comes through the device and being
Okay.
able to concentrate the activated oxygen in a high amount to be able to breathe, right? So if
Yes.
you have it, let's say uh, a big device that we have and it's running off in the corner, you're not going to be able to breathe in as much energy as you would need to create a significant health effect. Although that is something that we are potentially working on in the future.
All right. Okay.
Yeah.
So how long do I have to inhale the air once I put on the cannula?
This one we recommend 1 hour minimum a day.
Okay.
So this could be for people that are just wanting to maintain their health. They're already quite healthy, and for those that are suffering from any sort of chronic condition, we would work with them individually to figure out what would be best for them. But normally, I would recommend 2 hours a day with the home device for people that are dealing with the chronic illness.
All right. And what about children? Do they have like a specific timeline or is it the same?
The same.
Okay. Okay. So
Yeah.
adults and children, 1 hour is what you suggest. And if for chronic conditions, 2 hours.
Yes.
Oh, brilliant. So this is the device that you showed us is Forestier Home. But what
Yes.
about the one for professionals? Um,
Sure.
do you have
Yes.
that? Can we see it?
Absolutely. So here it is. Also, quite light and easy to use. With this one, we don't recommend traveling around with it as much as the other one, but yeah, we love it all the same. And yeah, we're able to breathe two people, right?
Yes.
And let me actually plug in power supply.
Well, that's nice that two people can breathe at the same time.
Yes, exactly. So whether it's a family or you have a
Yeah.
wellness center and you want to have it in the waiting room and have two people use it, it can become really convenient.
Fantastic.
Yes. So this is the Pro device. I don't have two cannulas with me or another person,
It's
but
okay. Yeah.
see, it's pretty self-explanatory.
Yes.
And yeah, user one, user two, also very
Yes.
easy.
Oh, that's nice.
Yes.
And it's the same thing. You add the cannula, you put it in, so it's exactly the
Same
same.
thing.
Oh,
Yep.
wonderful. That's
Yep.
that's very nice. I really learned a lot today, and it was fantastic just seeing you do all of that. And I just hope more people get their hands on this device because it's like, the magic that happens with it. Um,
Yes, of course.
yes, and you're always there in terms of guiding people if it's really severe chronic issue. So we're happy to have you on that as a guide as well.
Yes,
Um,
absolutely.
Yes. So thank you so much, Dr. Sarah. It's
Thank
been
you,
a
Gina.
very informative podcast, and I'm sure our viewers will have more questions, and we will want to have you again on with answering more questions. So for now, thank you very much, and have a beautiful day.
Thank you so much, Gina. Speak soon.
Yes.